I'd like to tell you about a significant problem, a visual problem that can occur during the use of Ozempic, which is semaglutide, or Mounjaro, which is tirzepatide, probably. The disorder is called NAION. This is non-arteritic ischemic neuropathy. It is not really discussed much, and it's a fairly significant problem that I thought you should be made aware of. What it is a sudden presentation of a visual disorder, generally loss of a visual field. It can occur in one eye, not the other eye. It can also affect visual acuity. It is untreatable. It is usually permanent, although in some people it will get better after a few months. We had a patient with this disorder who I'll describe in a little bit. So, significant problem, how frequent is it? Well, it is written that in type 2 diabetics, in general, it occurs 1.8% of the time, maybe 1 in every 50 patients. In type 2 diabetics taking semaglutide, it is said to occur 8.9% of the time, almost 10% of the time. That's kind of a high incidence for something that we really don't hear much about. It is said to be increased with tirzepatide too, but I don't have numbers for it. It is also said to be increased in people taking semaglutide for obesity or overweight, but who don't have diabetes. Again, I don't have numbers. So the patient that we had was taking semaglutide and presented with this problem. We are involved in clinical trials using exosomes for neurocognitive and intracranial disorders. So we are treating people, as we've described here before, with ALS and Parkinson's with some amazing results, actually. We have another arm for retinal disorders. So she was in that arm of it. She was and is our only patient in that part of the study with NAION. So she received the exosomes, and happily, she had significant improvement in her visual field a few weeks later. Prior to this, she was bumping into things because she couldn't see down. She could not drive at night. At present, and she's still in the study, she is able to drive at night, and her vision, while not perfect, is significantly improved. We don't know if it's going to improve more, but she is scheduled to get treated again, actually in a few weeks, with more exosomes to see if we can further improve it. We have seen incremental improvement with subsequent treatments with other disorders, again, such as Parkinson's and ALS. So we are hoping that this will occur with her. So semaglutide, it can be helpful with diabetes, but it's very helpful with weight loss. There are other complications, digestive and others, but clearly the loss of weight that people have experienced is very beneficial. But when you're doing any intervention medically, any pharmacologic or other intervention, you always have to consider risks and benefits. So losing weight for sure helps people to get healthier. This drug, again, has some other complications. It's also kind of expensive if you're not diabetic. But you're always better off if you can make yourself healthier by lifestyle changes rather than medications. This has been said forever, most recently by RFK Jr. So losing weight through lifestyle change, the best way, no doubt. If you can't do it and there's no other alternative and you have to take a medication, then you have to weigh the risks and benefits, and it may well be that it is in your interest to take it and it's the right thing to do. The purpose of this post, though, is just to further amplify the idea that whenever you're considering any intervention, you should be aware of all the risks and benefits. And it has struck me that this is a fairly significant problem with a fairly significant degree of frequency that I really don't hear discussed much. So not to say that it would be the deal breaker or not, but it is something that I thought we should all be aware of and factor into decision making if considering taking one of these drugs.